then you move on towards like removing the stones. Next is uric acid. I think uric acid is pretty obvious. It's because of the it accounts for 5% of the stones, and it has strong association with hyperuricemia, but it can also be seen with other disease. So with uric acid, always remember that cell turnover, if there's increased cell turnover, there will be hyperuricemia. So it cannot always be gout that's causing the hyperuricemia. It can be the increased cell turnover, which is of course tumor lysis syndrome, leukemia. That's where we correlated. So you if you alkaline, because it's like precipitated in, or it's a huge risk factor is the acidic pH. So if you alkalinize the urine or use allopurinol, it can be effective, right? So next we have the cysteine. So the way I learned cysteine stones was like cysteine, like the sound. So biochemistry sucks. So for cysteine stones, you need to know that this is a biochemistry relation. It's basically cysteine cola. So what happens is basically that it's a hereditary condition, right? So cysteine reabsorbing PCT transporters lose function. So what you'll have basically is poor reabsorption in cola. So C for cysteine, O for ornithine, lysine, and then arginine. Because of the defect in the poor absorption of the cysteine precipitates, and then it's poorly soluble, so it forms the stones in the urine. And it usually begins in the childhood. I think that's pretty obvious. It's autosomal recessive hereditary, so it starts from there. Yeah, this was the one. It can form staghorn calculi, but I think staghorn calculi is more associated with ammonium magnesium phosphate. And I think you can really differentiate between staghorn calculi in like, if it's in children, if it's in like cysteine stones, I think it will be like the history or the case will be pretty obvious. And if it's a female, or if it's like a leukemia patient, then I'm so sorry, if it's a female that has like a recent infection, or then you can think of ammonium magnesium phosphate. You do a sodium cyanide nitroprusside test, and it has like a funny smell, egg sort of smell, that basically is characteristic of cysteine stones. So the treatment is low sodium diet, alkalization of urine, and chelating agents that will, if it's refractory, right, for the chelation of the non-absorbed, the non-absorbed ornithine, lysine, and arginine. So the shapes. Honestly, like I said, I haven't really ever gotten a very strong hold on these shapes, but one way that I have learned is that it's mentioned over here as well, that for cysteine it's like 16, so 6 sides, it's hexagonal, and the uric acid is mostly rhomboid, and then S for struvoid stones, S for sarcophagus, and then wedge shaped and dumbbell. Honestly, like, you just have to ratify this. I never really understood or made a mnemonic for this, but yeah, that's it.